In today's modern world, it's poor eating habits. Would you take an antibiotic tablet every day to clean your gut? The mouth is such a vital organ. It helps us nourish our inner world and it helps us communicate with the outer world.
How different is that now?
If we have infections in our mouth from decay, from gum disease, from infected root canals and dead teeth, we are swallowing those bacteria and toxins.
What is it that you feel like people are missing in that picture?
Science is showing now that can affect the health of our gut. So we're seeing connections with stomach ulcers, inflammatory bowel diseases, and even things like bowel cancers are being linked to pathogenic bacteria in the mouth.
Is that something that can happen?
90% of what goes in our mouth is absorbed into our body. A bit like our skin. We're conscious of what we put on our skin these days, but what's going in the mouth will be absorbed into the body.
Is there a chance that the bad bacteria might grow quicker than the good bacteria and therefore that's part of the issue with the imbalance?
So you've heard the case of leaky gut. Well, leaky gums can do the same thing. So, when toxins are absorbed into the bloodstream, we can see links to cardiovascular issues, cognitive health, like Alzheimer's disease, pregnancy, fertility. All parts of the body can be affected.
How did I not know this? This is true?
Look, it is something.
Excited for this episode of The Wellness Collective. We have got Dr. Aushi Patel and we are going to talk about dentistry in a holistic way. She is a wealth of information. She has been a dentist for more than 30 years and she's going to blow your mind with a couple of things that you're probably doing every day that maybe after this episode you might stop doing. Let's get into this next episode. Aushi, you probably don't know this, but the way that I discovered you and your work was actually through one of my patients.
Oh.
Now, I'm in Melbourne and you're in Sydney.
Yes.
So that's how much in demand you are.
That is so good to hear.
And she'd said to me, you need to meet Aushi. She was like, she's going to change the way that you are looking at, and not that I'm an expert when it comes to dentistry in the mouth by any means, but she was like, she's the person. So thank you for joining me. I'm very excited.
Thank you for the invitation.
Yeah, of course. So you are a dentist.
Yes.
And I would love to hear about how or what inspired you, because I don't know many people that wake up and go, I'm going to be a dentist.
True. It's not up there with the most glamorous of careers. Nat, I wanted to be a dentist since I was about 8 years old. I have dentists in the family, and at around 9 years old, I saw one of my uncles doing some dental surgery, and it fascinated me, the whole process. And from that point, I knew that that's what I wanted to do. So almost 30 years later now in the career, here I am. And yeah, it's been amazing.
And 30 years is a long time to be in a profession, although probably still you've got many years to continue to help people. But what has been the evolution of those 30 years? Because I think where we start and then what the version of ourselves we are 10 years in, 20 years in, 30 years in continues to evolve. How different is that now?
So different, so different. I think today I am even more passionate about being a dentist. It's really, particularly the last few years, it's just been a breath of fresh air to go back to study, to write my book, and really think about what I want to, give to my patients, and leave behind one day. And it's evolved very slowly at times over the 30 years, and at other times aha moments have come, and I've gone down many rabbit holes. And yeah, it's and I think in today's world where so many people are looking for more natural alternatives, wanting to empower themselves and take control of their health. And I'm here going, the mouth is right up there. If we want to be healthy, we need to start looking at oral health, and that's That's a deep passion of mine.
I think part of us knows that we need to look after our teeth and our mouth. I think our teeth, I don't even think people realise the mouth and the teeth are kind of all of it. I think we look at teeth brushing as being hygiene. But I think that we really are still not very aware of how it's kind of like an ecosystem in itself and then some, like, you know, obviously connects to your gut. How is it that you're educating people around all the importance? Everything starts, I would actually say, in the mouth, really, because it's the first place that things enter.
Absolutely.
How do we talk about that more? Like, what is it that you feel like people are missing in that picture?
Well, you know, I think it's, well, the mouth is such a vital organ. Let's start with that, you know. It helps us nourish our inner world and it helps us communicate with the outer world. You know, we eat with it, we drink with it. Some people breathe through it, you know, these days, and that's another story. But a lot of people, you know, breathe through their mouth. We smile with it, we speak with it. You know, it's a very vital organ. And also, it is so intimately connected to the rest of the body. And as you just mentioned, you know, the gut, the most direct connection the mouth has to an organ. And as far as I'm concerned, the mouth and the gut is all one organ, really. They're just different stations along that organ. And, you know, we swallow 2 cups of saliva a day.
Yeah, that's a lot.
That's a lot.
It's kind of
2 cups, you know?
Yeah, right.
And so what are we swallowing? If we have infections in our mouth from decay, from gum disease, from infected root canals and dead teeth, we are swallowing those bacteria and toxins. There are also man-made toxins, you know, fluoride, mercury from amalgam fillings. So when these you know, toxins are swallowed, they go into our gut, they can alter the microbiome in the gut. And, you know, that's a big topic these days, I see, gut health, microbiome health. Well, we've also got a microbiome in our mouth as well. So when these toxins go down into our stomach, science is showing now that that can affect the health of our gut. So we're seeing connections with stomach ulcers, inflammatory bowel diseases, and even things like bowel cancers are being linked to pathogenic bacteria in the mouth. The other way the mouth is so connected to the gut, it's the place where our digestion starts. So if we are not being able to use our mouth in the correct way, our digestion it's compromised from the get-go. And I say to my patients, you know, you can be eating the best food, organic this, biodynamic that. But if that first stage of digestion isn't starting, and that is carbohydrates and some fats, that undigested food will not be looked after further down.
Right.
And those situations can occur when, you know, people are missing teeth, so they're not able to chew their food properly and mix it with the saliva. And in today's modern world, it's poor eating habits. You know, my practice is in Sydney CBD, and, you know, at lunchtime, if I walk through the food courts these days, Nat, you know, it's scrolling and, you know, and eating.
Unconscious eating.
It's, you know, we're not giving it the honor that it needs. We're not nourishing every aspect of ourselves. So once again, you know, undigested food matter goes down into the gut. And that relationship is two-way. So if we have gut issues, that can affect our mouth. For example, imagine if you have reflux and you have acidic fumes coming up into your mouth. That will alter the microbiome and create a situation where bad bacteria are going to start to flourish, and that can open the door to dental disease. And the acids can also erode the teeth, so start to weaken them as well. So that connection is extremely important. So when my patients come in, I'm interested in their mouth, but also what's going on with their digestive health as well.
Right.
And then we also know that, you know, toxins from the mouth can enter the body through the bloodstream as well. So you've heard the case of leaky gut. Well, leaky gums can do the same thing.
Right.
So, when toxins are absorbed into the bloodstream, we can, see links to cardiovascular issues, cognitive health like Alzheimer's disease, pregnancy, fertility, all parts of the body can be affected.
It's interesting. I don't think a lot of people would think about their fertility, especially as being something that they might need to check in with what's actually happening. Well, yes, with the gut, but also the mouth. So what I'm hearing is, and correct me if I'm wrong, but the approach that you're taking is very holistic in the sense that you're considering many factors, not just the mouth. And is there anything else outside of that when you use the term holistic or more natural approach? Does it extend to anything else? I think that we're very good at operating as silos. Like I said, no one's considering the big picture of the body and it all works as a symphony. We like to separate it out and think we can separate the systems, but it doesn't really work like that.
No.
So is there anything else that you add to that as a holistic, from a holistic approach?
So I think one of the pillars of a holistic approach would be to always seek the root cause. What is causing this issue? So, if you have something like a recurrent dental decay, let's look at what's causing that. And it's more than brushing and flossing. We know that. So if somebody comes in, I'm going, well, are you breathing through your mouth or your nose? If somebody is breathing through their mouth all the time, their saliva will dry up. And that will predispose them to dental decay. What's their nutrition like? Are they getting enough fat-soluble vitamins like vitamin D and K2 and A, which we need for our healthy bones and teeth? When people are clenching and grinding, often it's a stress reaction. So we're looking at, how are you managing that? Gut issues can also cause clenching and grinding. So it's looking beyond and going, well, where are the areas that we can look at beyond the mouth that can be connected to this? And then the other approach is to go, well, how can we manage this as naturally as possible? Correct the underlying issue, but then also, look after our mouths in a way that is not going to be detrimental to our general health, and that extends to the oral hygiene routines and the products we use in our mouth on an everyday basis, things like that.
So I think also when we look, especially from just, I guess, run-of-the-mill general dentistry, a lot of the things that are treated are kind of like a set and forget scenario, like, oh, that's fixed now, without looking at those things. So, I don't know, gingivitis or gum disease or these sorts of things, or even just a cavity, without looking at the other reasons why that's happening for somebody. And, I think that is such a huge part of the reason that something is occurring. But it blows my mind that we're still really not that far down the road with that when it comes to kind of like I've done my job in a regular dental scenario. I've done my job. I filled the gap, filled the hole. See you next time you need another filling. What you're saying is that there's all these other things that are involved that you're really passionate about educating the patient around to prevent it more of that from happening. Can you also, if that's the case, can you change the landscape of the mouth to heal things that we might actually be treating? Like, is that something that can happen? I mean, for example, I think gingivitis maybe is an example of that, or eroding gums. Like, are those things forever, or is there things that you can actually do to treat it?
Oh, absolutely. There's always ways to improve that oral environment. So one of the main things is to make sure, like we do with the gut, to look after our oral microbiome, which is a community of, healthy, good bacteria that we need, and there are unhealthy pathogenic bacteria. Now, if the balance is kept as such where, the good bacteria are in control, then, that sets the scene for health. And when, the environment changes, and when I'm talking about the mouth, when the mouth becomes more acidic in general, that's when pathogenic bacteria, disease-causing bacteria will start to take control. So if the first thing we look at is let's keep the oral microbiome healthy. One of the first things I talk to my patients about is, the products that they use in their mouth. So if we're using, harsh toothpastes and mouthwashes with chemicals, with alcohol in them, we are wiping out all the good and the bad bacteria. And the way I describe it is, would you take an antibiotic tablet every day to clean your gut? And most people are horrified, that's not a good thing to do. And so it is about looking at ways that we can naturally enhance our oral microbiome, support the good bacteria without wiping out everything.
And also, if you are using, say, mouthwash, a lot of people would probably be hearing this going, sorry, what? But if you are, correct me if I'm wrong, but if you are using, say, mouthwash every day and clearing out all the bacteria, is there a chance that the bad bacteria might grow quicker than the good bacteria, and therefore that's part of the issue with the imbalance?
Absolutely.
Right.
Yeah, absolutely. So that's when the bad bacteria take over. And depending on what bacteria it is, that can be, setting the scene for decay or setting the scene for gum disease, which are pretty much your two dental diseases.
So the person that loves mouthwash, what are they going to do instead?
There are other options. Very basic is swishing with coconut oil,
right.
And many people, we hear about it on the internet. Oil pulling is the word. It's an ancient Ayurvedic technique, originally used for detoxifying the body. But coconut oil is a great mouthwash, And I say to patients, you don't have to do 15 minutes a day,
Yeah.
We're not living in ancient India 5,000 years ago. But swishing with coconut oil is a great way to, swap from a chemical-based mouthwash to something that will support the good bacteria. Some of the components of coconut oil have been scientifically proven to, eradicate the bad bacteria. It's very moisturizing as well. So if one has a dry mouth, it's great. And it has a pleasant taste as well. So for freshening breath as well, it's a good alternative.
And what about toothpaste? Because I'm assuming it's probably in a similar category.
So toothpaste as well, a lot of them contain foaming agents, fluoride, colorings, things like that once again can alter the oral microbiome. The other thing, Nat, is that 90% of what goes in our mouth is absorbed into our body. A bit like our skin, we're conscious of what we put on our skin these days, but what's going in the mouth will be absorbed into the body. If you look under the tongue, there's a lot of blood vessels under there, and that's why homeopathic drops, medications are often administered under the tongue for that reason. Yeah.
So you would look for an alternative that doesn't have a lot of those things that you just mentioned. And there's some great options out there, right?
There's a lot of great options. Yeah. And, a lot of essential oils can do that. There's research has shown things like clove oil, cinnamon oil, peppermint oil. They're all really good for, supporting the oral health and not wiping out the bad bacteria.
So easy things that we can do just by swapping out something can have a really big impact. How long do you think the average person would need to switch it out to see benefits?
Look, that depends on the health of the mouth and how long, if something's going on, how long it's been there. But, often I see patients that start flossing and they panic going, my gums are bleeding even more. And I go, look, that takes time to reverse. Right. Look, if you were diligent, I would say within 3 months, you should start to see some benefit. Yeah.
I know one of the things that you do is the removal of amalgam fillings. I had mine removed a few years ago. That was a wild, fun ride. When you know something about yourself, but you go to a different health provider and they don't believe you. So I'm like, well, one side of my mouth is way less responsive to anaesthetic than the other, which I think is actually quite common, isn't it?
It can happen, yeah.
Right. Well, I know this, but no one ever believes me. And so, of course, I'm in there and I'm having them removed, and they'd set it all up to remove, I think I had 2 or 3. And I'm like, I can feel that. And they're like, really? And I'm like, oh, no, I can really feel that.
Oh, no.
I was like, I tried to tell you. Awful. Anyway, I don't mind going to the dentist as long as I can't feel it.
Yeah, I'm the same.
Yeah, right. So what's the importance of removing the fillings, the old school fillings? And is there anything else that you do that's different to what we're traditionally doing?
So amalgam fillings are 50% mercury, and if you're going to have them removed,
how did we even start putting them in there in the first place?
Look,
because someone was like, this is a good idea, let's put some mercury in your body.
50% mercury. They're made of silver, tin, copper, metals like that.
Things that you build your house with.
Well, it's a strong filling material. And
well, that's why I had to have mine out, because the teeth were actually split. Or splitting. They weren't fully split.
Okay.
But it was actually a blessing in disguise, because I probably would have just been like, oh, yeah, I'll get around to that one day.
Yeah.
And then they were like, oh, actually the teeth are split, because it's quite it's not it doesn't expand, does it? It's quite rigid.
It is rigid.
Right.
Yeah, it's rigid. And look, it was, brought into dentistry because it was quite
rigid.
Cheap. Hard, very hard, and very easy to use as well. So I think the important thing to know is that when you have them removed, it's really important to have some protective measures in place when that's happening. And that's what I do in my practice if an amalgam filling has to be removed. The most amount of mercury is released when these fillings are put in and when they're taken out.
Right.
So, having a rubber dam on over the tooth to physically protect you from swallowing bits of amalgam, or worse yet, a sludge collecting under the tongue. And a separate air mask as well, just to protect from the fumes that do come off of the fillings as well. So things like that I think are really important.
Yeah, that's what they had. They'd set it all up, put the dam in, and then I could feel it.
And then you could feel it.
And then they were like, I had to take it all out and numbing again. And actually it was that caused the most amount of pain. It was the fact that they'd kind of had to put it in, take it out, put it in. It wasn't the actual process. I think it was more the round got inflamed because they took it in and out
clamp,
again.
Yeah, the clamp can be tight. Yeah.
Yes. But anyway, and I didn't really have any other reasons. Like, I had no real health issues. It was just the fact that the tooth was split. But like I said, it was a blessing in disguise, because they'd probably still be in there. Because, it's one of those things you go, I'll get around to that. It's not until you're actually like, oh, this is a problem.
Yeah.
For the person that is listening, I guess it's important to it's recognised that we don't want the fillings in there anymore. Anyway, are they still even used?
Look, they're being phased out now. Yeah,
right.
And there are better alternatives, available. I mean, dentistry has made some incredible advances over the years, and particularly in our materials that we're able to use. So these days, I can use a fluoride and BPA-free white filling material.
Right.
The ceramics that, we use for crowns and things like that are very strong as well. So we've been able to move away from metal. I hear that they're also making ceramic implants for people that, do need implants and don't want the metal in their jaw as well.
Right,
so,
right.
Yeah.
It's fascinating, just, I guess, how we advance in certain things, but we're still not looking at lifestyle or all these other things that you're talking about. But thank goodness that we have these measures that can help us as well, because otherwise, if we're not looking after our teeth equally, we've got more chance of infection and all these other things that you're talking about. I learnt not that long ago, which blew my mind because I am an acupuncturist, or trained as an acupuncturist, that each tooth kind of corresponds to a different area of the body. And I was like, sorry, how did I not know this? This is true?
This is from a TCM point of view.
Right. Well, see, I missed that class. Well, back in the day.
I have the chart. I will send you a copy.
I Googled it and I was like, wow. But would you look at that with a patient?
Look, it is something. Obviously, we can't make a diagnostic, assumption from that, but it is something that, we're aware of. And of course, we know acupuncture, which is, widely accepted as a modality, that, it is, we do have meridians that run through our mouth, and different teeth lie on different meridians. So For example, the front teeth, the incisors, lie on the kidney, bladder, urogenital meridian. So the eye teeth lie on the liver meridian, and then the back teeth are more related to the stomach and the gut. So from a TCM point of view, it's been put forward that, if there is an issue, a blockage of chi, of energy in the mouth, then that can potentially have an effect, on other parts of the body, organs that
It can
lie
be
on
nice
that.
for you to also say to patients, in TCM, this corresponds to this area. It's something they can go and actually then explore. It's obviously not necessarily, it doesn't lie on your shoulders because you're not necessarily trained in TCM, but it's nice for them to be curious because they've probably got other issues that they don't even realise that are all connected to that same disharmony in their body.
Yeah.
Yeah, I don't know. I must have really absolutely missed that class. I was absent that day. So for the person that's listening and wants to take more of a holistic approach to their regime, what do you suggest or recommend for that person that's listening that they can start to have some tangible things that you recommend?
Okay. Simplest, there's so many simple little changes that one can make to, start improving their oral health. One of the most important things I would say is to clean your mouth as soon as you wake up. So the reason I suggest that you clean your mouth first thing upon waking is when we are sleeping at nighttime, our salivary flow drops down. We obviously don't need to have our mouth as wet and as lubricated. And our digestive organs are actually detoxing and repairing themselves. And this is from an Ayurvedic perspective of looking at gut health. So at nighttime, when the digestive organs are releasing toxins, most of them go south and end up in the toilet the next morning, hopefully. And a lot of them do travel up and settle on the tongue at nighttime and on the teeth.
Is that why it sometimes feels like you've visited exotic countries when you wake up in the morning?
Morning breath. Morning breath.
You're like, I did not eat onion, but why does it taste like onion?
Exactly. Or garlic, right?
Yeah.
So that's it. And
Right.
so if you go and eat or drink straight away, you're going to re-swallow those toxins. So it's good to clean the mouth after, X amount hours of sleep, and then intake your food and drink. I say it's like drinking water from a dirty, stagnant pond, clean the mouth. The other important thing I do, ask my patients to do is to clean their tongue. Studying at, a Western university, I qualified in London. Oral hygiene was pretty much about brushing, flossing, and maybe a mouthwash.
Right.
And we don't really pay much attention to tongue health. So I recommend, first you brush, you floss, and then you use a tongue scraper and clean your tongue. And then you can swish with something like a coconut oil, mouthwash. Yeah.
What about gums? Do we need to do anything for our gums? Or are they okay? Do we need to brush them?
Brushing the junction of the teeth and the gums is probably the most important area because that's where a lot of the bacteria live as well, around those gum pockets that sit around the teeth.
Yeah, right. I've always wondered that. I think I don't mean right up high, but I feel like we brush teeth. We probably forget about that part there.
That's an important area. Yes.
And then lastly, what about I guess it's the same for children, right? It doesn't really change. Is there anything else? Have you seen changes over, you've been in the industry for 30 years, but I feel like, and I could be wrong, I see a lot of patients and children needing more and more care with their teeth, like, fillings and things like that. Is there something that we're doing wrong, or is it actually like a lifestyle? Could it be genetic? I guess it's all of the things, isn't it?
Look, it can be many, many factors involved. As we've evolved, the rate of dental disease and stuff has been related to the change in our oral microbiome, and that's connected to our diet, where our diet isn't as varied anymore with, all the different nutritional things that we need. And also jaws have narrowed as well. So I'm seeing
over how long?
Look, this is many, many, many years.
Right. But that's interesting still because we're not probably killing things and eating them then and there? And is that, you know?
It's the softer diet, you know, it's how the sort of foods that we're eating. So we've moved away, like, you know, 10,000 years ago approximately, we moved from hunter-gatherer to the agricultural revolution. Then the mid-1800s, excuse me, we went to an industrialized diet. So through that, our oral microbiome has changed anyway, and our jaws have narrowed, also to accommodate our expanding brains as well. So we're seeing a lot more narrowing of jaws. Wisdom teeth, you know, they're counted as extra teeth, but back in caveman days, you know, they were actually functional teeth because our jaws were wide enough to be able to accommodate them. And the other thing we're seeing a lot of is the mouth breathing as well.
So is that increased? Has mouth breathing increased?
I'm
and
seeing
you think it's a stress thing?
Look, I'm seeing a lot more of it. Look, it can be a stress thing. Often there's nasal obstruction or something going on that is preventing person from breathing through their nose. Like I say, the nose is for breathing, the mouth is for eating.
Right.
And
You're definitely not eating through your nose.
No. And you shouldn't be breathing through your mouth, you know. It dries out the mouth, causes bad breath, leads to dental disease. And also we get about 20% less oxygen in our body when we breathe through our mouth as well. So, yeah.
Amazing. Well, thank you so much for joining me today.
You're welcome.
I'm sure that people are now thinking through, I think the one thing people will be like, what, mouthwash? What do you mean I can't use mouthwash? But it's not you saying you can't use it. It's just using something that's going to actually be more beneficial in the long run. Yeah. Well, thank you so much. It's been such a pleasure to talk to you today.
Thank you, Nat. Thank you.
Hey there, it's Nat Kringoudis, host of the Wellness Collective podcast. I know how important it is to have a safe space for women's health, and that's why we created NK the Membership, an online sanctuary where you can access expert guidance and support right from home. Get early access to monthly masterclasses, unlimited access to our entire catalogue, and practical resources to achieve hormone harmony. Plus, enjoy a 20% discount on supplements and join my monthly live Q&A sessions. Join our community of like-minded women and wellness experts to revolutionise your health one topic at a time. Visit our website and sign up now. It's legit Netflix for hormones.